Hi, this is Michael Ostrolenk, and I'm talking to Adele Hite. She is the Executive Director of the Healthy Nation Coalition. Hello, Adele.
Hi.
Tell us a little bit about yourself and the Healthy Nation Coalition.
Well, I'm a graduate student in nutrition epidemiology at UNC Chapel Hill. I'm working on my PhD. I will also be graduating very shortly with a master's in public health and registered dietitian. I'll be ready to become one of those very soon. And the Healthy Nation Coalition grew out of a concern that I had, along with a number of other scientists, dietitians, academics, with the science behind the dietary guidelines. We were not seeing what we felt was a fair and accurate representation of the science that we knew being presented in the guidelines. And that's been sort of a historic flaw with the guidelines, but with this last round of dietary guidelines it became painfully apparent.
Guidelines. What are the guidelines?
So the dietary guidelines are the nutritional principles upon which all of our federal nutrition programs are based. So school lunch program, the Women's, Infants, and Children's program, the food stamps, it's now called SNAP, all of those programs have to adhere to these nutritional principles that are found in the dietary guidelines. And more than that, so that's just sort of the legislative, official use of the guidelines, but the guidelines actually, even if you've never heard of them, they affect your lives because they give us, as American citizens, a working definition for what healthy is. So the idea that something that's low in fat, that's high in fiber, that's low in sodium, that's low in cholesterol is good for you, that comes from principles found in the dietary guidelines. Research protocols are based on the dietary guidelines. The way that we treat people with nutritional therapies are based on the guidelines because that's what's in the research. Consumers demand food that's healthy because it's based on the guidelines. So they want food that's low in fat, that's low in sodium, that meets all those criteria found in the guidelines. And then therefore industry produces food that matches the healthy criteria provided by the guidelines. So it permeates every aspect of our food environment. It's not just an official document.
And the guidelines are created by the USDA, is that accurate?
They are created by the USDA and the Department of Health and Human Services. So they work on this together. They alternate administrative lead, but the truth is that the USDA is in charge of all promotional materials that go with the dietary guidelines, or the vast amount of the promotional materials, and in terms of administration, it's housed in the USDA. So the USDA really has more control over the guidelines than Health and Human Services does, although it is theoretically a partner undertaking.
So the guidelines guide basically American food policy, both, you said research, federal food policy, dietitians, what's appropriate for them to promote and suggest to their clients, how hospitals offer food, et cetera, et cetera. But you also started this conversation by stating there's some concerns with those same guidelines. So is our whole food policy misguided, or some of our food policy misguided? What are your concerns with the guidelines?
Historically, when the guidelines were created back in 1980, those were our first guidelines. But previous to that, government had been giving out nutrition advice, but it was all about acquiring nutrition, getting the basic nutrients that you needed to be healthy. In 1980, we switched our focus from that to prevention of chronic disease. The problem with that is we don't know how to prevent chronic disease with nutrition. The science behind that is weak, it's inconclusive, it's different for different populations, so what may prevent chronic disease in me may not prevent chronic disease in you, and we know that there are differences for various subpopulations. Also, our nutritional needs with regards to that may have effect on chronic disease will change over our life course. So depending on age, gender, disease state, pregnancy, all of those things, your nutritional needs may shift, but our basic nutrition needs stay the same. So when we changed our direction, we changed the accuracy of our advice. And we went from being able to say what we know to saying things that we didn't know.
Well, some of the things you mentioned low salt, low fat, low cholesterol. And I know that science more recently, even in the past, has questioned those assumptions. Can you speak to how those assumptions are being questioned and how that might in fact affect food policy?
Sure. So those are the three biggies are the fat, cholesterol, saturated fat issue, a healthy diet is a high carbohydrate diet issue, and we need to lower sodium in order to prevent hypertension, which is a risk factor for heart disease. Those are the three big issues. And the reality is that since 1980, all of those three principles have been controversial. And we have not had science that confirms that any of those are accurate for a population-wide diet prescription. So let's just take the saturated fat issue. What we were asked to do in 1980 is remove the saturated fat from our diet and replace it with vegetable oils. This meant reducing our intake of red meat and eggs, which we did, and increasing our intake of polyunsaturated vegetable oils, corn oil, soybean oil, which we did. This is problematic though, because for some folks, increasing those polyunsaturated oils actually creates a dyslipidemia that increases their risk of heart disease. For some folks, lowering saturated fat does lower your cholesterol levels, but that doesn't necessarily mean it's going to prevent heart disease. So we haven't been able to connect all those dots, and what we've done is we've changed our consumption so that we're eating less protein, we're eating less of these whole foods, eggs, meat, that are actually good for you, that provide adequate protein, that provide healthy essential fats, and we've really increased our intake of processed foods where the nutrition content can be easily manipulated. So it's easy for a food manufacturer to take the saturated fat out of a granola bar or a pastry product and replace it with a vegetable oil. It's much, much harder for a farmer to do that with an egg.
So that's the saturated fat / cholesterol.
Mm-hmm.
But I also know there's some questions about cholesterol being a determining factor in heart disease. And that's put into question not only what we should eat or shouldn't eat, but also all of the medications we're given to fight against heart disease. Can you speak a little bit to that as well?
Well, what's been sort of interesting about this is that we've been given this 300 milligram as sort of the intake a day. So from the dietary standpoint, we're not supposed to take in more than 300 milligrams of cholesterol a day. Well, we never really have, or we've never gone much over that. So there seems to be sort of a natural intake of cholesterol that we sort of just revolve around. And then if you look at how that translates into serum cholesterol, well, dietary cholesterol is only a small part of whether or not your body produces cholesterol. And in fact, dietary carbohydrate plays a large part in whether or not your body will produce serum cholesterol. So that's another disconnect. Then you get to the whole notion of, what is a normal healthy cholesterol level? Well, we know that the vast majority of people who have heart disease have normal cholesterol levels, and vice versa. So people die of heart attacks and their cholesterol is normal. People whose cholesterol is above normal don't have heart disease. So there's not a clear one-to-one correspondence between what your serum cholesterol measures and what your heart disease outcomes are going to be. So that gets at the statin issue. Do we really need to lower people's cholesterol? Well, we know for people who have hypercholesterolemia, which is a genetic issue, it's beneficial. Is it beneficial for everybody? Not necessarily. We also know that low cholesterol is problematic, especially with regards to stroke. Cholesterol is an important part of that cellular structure and helps maintain cellular integrity, in addition to being something that helps us to metabolize fat-soluble vitamins, create sex hormones. It plays a valuable role in a lot of our metabolic processes, and when you get in there with a medication and you start tweaking those metabolic processes in order to deal with just this one particular outcome, you're not paying attention to the whole array of other things that may be affecting. And that can really be problematic. You know, a lot of people who start on statin drugs can't actually keep taking them, and there's so many bad side effects that they have.
Yeah, some of the things I've been reading recently is a way to look at cholesterol, and one way to look at cholesterol, including the LDLs, the quote-unquote bad cholesterol, but it's kind of silly to call good or bad.
Right, right.
Is that high LDLs are actually a symptom of another process. And by masking it, by lowering it, actually does not change the underlying problem.
Right.
Can you speak a little bit about that if you're familiar with that?
Well, again, it goes back to how does the cholesterol get in your bloodstream in the first place? The vast majority of it is being metabolized by your body. So then the question you have to ask is, why is your body making less cholesterol, right? So your body has little signaling processes that let you know when there's not enough cholesterol in, say, the lipid bilayer in a cell, and your body needs to produce some more. And so yeah, you may have some dysfunctionalities in terms of metabolism going on there. It's causing your body to produce more. Dietary carbohydrate is part of that. And the bottom line with regards to heart disease risk is that it's the oxidized LDL. So it's not LDL by itself. It's the fact that LDL spends more time in your bloodstream and so it's more likely to become oxidized, but it's the oxidation process that makes it part of the plaque buildup. So then we have to go back and ask ourselves, what's causing all this oxidation? Well, if you're a biochemist, you know that glucose metabolism produces more free radicals or reactive oxygen species than lipid metabolism does. So part of these oxidizing agents that are causing the LDL to be oxidized come from, well, again, what we eat. And again, it comes back to this sort of excessive amounts of carbohydrates that we've been directed to eat, according to the guidelines.
So if I was a conspiracy theorist, I'd say, wow. So these guidelines being promoted by the federal government and various interested parties push high carbohydrates in the diet. High carbohydrates can cause an increase in LDLs.
Oxidized LDL and LDL, depending on your metabolism, yeah.
And because we've lowered the number for cholesterol, we need that much more number of people on these statin drugs. So it's kind of like a vicious cycle that creates many more patients for this, no? And
yeah.
You don't have to be a conspiracy theorist to believe this. It just seems to be the fact that this is a cycle that can lead more and more people into this process.
Well, what we can say for sure is that we don't know. Is that we do not know what dietary factors are going to cause heart disease or increased heart disease risk in any given individual. So a person who is young and active, they may do fine on a high carbohydrate diet. For someone who is older and sedentary, a high carbohydrate diet, it may be exactly the wrong thing to feed them. So from a scientific point of view, I just think that the guidelines, that the U.S. government needs to get out of the business of pretending that we know what the right diet for you is at any given point in time.
So you're basically talking about bio-individuality.
Yes, to a large extent. And the thing is, we pretty much know what the macronutrient needs are. We have essential protein needs, we have essential fatty acid needs, we have essential vitamins and minerals that everybody needs. You need it, I need it, we need it, may need it at different levels over our lifespan, but everybody needs those things or we get sick. Now, preventing chronic disease, that's a whole different story, and we do not have conclusive evidence about this. And in fact, we have lots of evidence that diverges. So a high carbohydrate, low fat diet may work great if you're white, if you're male, if you're Caucasian, if you're Northern European descent. It may not work well if you're African American, if you're female, if you're older. So that sort of evidence that we see these divergent populations tells me that the government can't give out one-size-fits-all recommendations with regards to preventing chronic disease.
So at the Healthy Nation Coalition, which is www.4FORAHealthyNation.org, what are you encouraging your members and the general public to do with this general critique you have of the guidelines?
Well, the main thing that we want them to do is be informed. That's the most important. So our primary mission is to educate the public. And then it's the public's job to educate their healthcare providers, to educate their policymakers. So we can't blame industry. We can't say, well, the reason that we're all getting obese is because industry has provided us with this food. And no, we have choices as consumers, and we need to make those choices. We need to voice them. In terms of our own personal behavior, find out what diet works best for you. Don't assume that what the dietary guidelines are telling you is accurate, because it may not be accurate for you. And then when you figure out what works for you, you be in charge of your healthcare process and tell your physician that you're going to lower your cholesterol a different way, or you're going to lower your A1C level without insulin, because it can be done. So we need to take charge of our health. Then we need to look beyond our own world and look at how these guidelines and these policies are affecting folks who don't necessarily have the time or the wherewithal to track down the science behind the guidelines, and change policy so that more accurate nutritional policies will then reach those populations that are affected by people whose choices are governed by those policies. WIC program, school lunch program, SNAP Ed folks.
Great. Well, thank you, Adele. And for more information, people can visit a Healthy Nation Coalition at www.4FORAHealthynation.org.
Thank you.